Hello viewers, my name is Dr. Charit. I am an interventional cardiologist and practice at Vikram Hospital, Bangalore, and the founder of Tricog Health Services. When there is blockage in the blood supply to the heart muscle, every time you exercise, you walk or climb stairs, the demand of blood from the heart will increase. And because of the blockage, the supply of fresh blood to the heart muscle is restricted. This phenomenon is called ischemic heart disease, a condition where there is less blood supply or ischemia to the heart muscle. What are the symptoms of ischemic heart disease? Every time you exercise, and this could be physical, you may be climbing fast, you may be climbing up the stairs, or after a large meal when you walk. If you develop symptoms, this is indicative of a heart problem. And these symptoms of heart disease can be very, very varied. The typical symptoms of what we know of a left hand pain may not be there for all patients. Ischemic heart disease may manifest as a tightness of the chest. It could be a jaw pain, it could be a throat pain, it could be radiation to either left arm more commonly or even the right arm. It could be presenting as acidity or very rarely giddiness, breathlessness. There is a condition called silent ischemia, which may lead to a silent heart attack. This is most common in patients who are diabetic for a very long time. Because of high sugar, the blood supply to the heart and the nerves that carry pain sensation from the heart are damaged. This is the reason why diabetics do not complain of chest pain in the classical form. They may only have breathlessness when they walk, and we call this angina equivalent. Very rarely they may only present to you as epigastric or stomach burning pain. So if you are a diabetic, these are symptoms that you must never ignore. What causes ischemic heart disease? There are risk factors that cause ischemic heart disease, and these are diabetes, hypertension, cholesterol, high stress and tension, and multiple other factors such as genetic factors. Amongst all of these, you have the most common ones, that is blood pressure, sugar, and cholesterol, which are all under your control, and that is why they are called modifiable. They are modifiable by both lifestyle, which is the foundation of this treatment, and good medication that will help control these risk factors. Another set of risk factors are those which are genetic. Some people are genetically predisposed to heart disease. These are not something that is there under your control. Age is another risk factor, which is a non-modifiable risk factor. As we grow older, in the process of aging, blockages develop within the blood vessels of the heart. Heart disease happens when, in the first step, you have risk factors that develop. People develop diabetes, for instance, blood pressure. The next step is progression of the risk factors, which is these risk factors which are there remain uncontrolled over a duration of 5 to 10 years. It takes 10 years before blockages become severe enough to cause a problem. And lastly, the plaque or the blockage which is formed as a result of these risk factors will rupture one day, leading to a heart attack. So our focus must be on prevention, and you have 10 years a window period that long to prevent heart disease. All of us know prevention is better than cure. And in the case of heart disease, nothing is more true than that. Once you have a heart attack, there is damage to the heart muscles which cannot be reversed. So the ideal solution is to diagnose risk factors early, and if you have risk factors, to make sure that they are well under your control to prevent the progression of blockages forming and leading to complications later on in life. You hear these days of young individuals developing heart attack. In our society, other risk factors such as lifestyle-based risk factors like smoking are becoming more and more common, especially in the younger age group. This is one risk factor which even one cigarette a month is enough to cause damage to the endothelium of the blood vessels. You can think of endothelium as the Teflon coating that coats the blood vessels that supply the heart. This Teflon coating prevents blockages from happening. Other risk factors and smoking damage this endothelium, leading to blockages forming early. Indians, by their very genetic makeup, are more prone to heart disease, which happened a decade earlier than the Western population. Not only do they develop early, but also the disease that is there, once you do an angiogram, you will find that the disease pattern is more diffuse, which means it involves the entire length of the blood vessels that are supplying the heart. In the West, it happened a decade later and only involves a small portion of the heart. So, because of our genetic makeup, heart disease is happening at a younger age in the population of our country, which puts more and more emphasis on ensuring that we live a healthy life. And what does this involve? You can prevent heart disease, and it is entirely in your control. The foundation of that is healthy living. To make sure that our diet is healthy. To make sure that we exercise at least 30 minutes a day, 5 days a week. To ensure that we don't have habits such as smoking. And finally, to control the other risk factors such as diabetes, blood pressure and cholesterol. You need your fasting blood sugar to be around 100. You need your HbA1c to be less than 7. You need to make sure that your blood pressure is less than 130 by 90. You need to make sure that your LDL cholesterol is brought under control. And another endemic which is now common in India is obesity. So controlling all of these, which starts with healthy living, is the first step to prevent heart disease. How do you diagnose ischemic heart disease, or how do you know if you have a problem? Well, your doctor will advise commonly 3 tests. One is an ECG, followed by an echo, and lastly a treadmill test or a stress test. An ECG is a picture or a snapshot of the electrical activity of your heart. And if there is severe blockages, you may find changes in your ECG which lead us to the clue that you may have a heart problem. Of course, if you are having a frank heart attack, the changes of an ECG is one of the simplest ways to diagnose if you have a serious heart condition. The second test is a cardiac ultrasound called echocardiography. This is an ultrasound of the heart which gives us information of the mechanical functioning of the heart. So if there is any damage to either the heart muscle or the valves, we can find that out using the cardiac ultrasound. The third test, which is a stress test, you will be asked to walk on a treadmill with the speed and the slope gradually increase. And the idea of this test is to increase the work that the heart is doing and then see are there any changes that are happening in your ECG or your echo. So these are the three commonest tests that are prescribed which are non-invasive. You have another test called a CT coronary angiogram. Now, amongst all the tests that are there, this has the most accurate sensitivity for detecting blockages. It does have the only disadvantage is that there is dye that is involved and radiation. So people are very selective when you need to undergo a CT angiogram. This is not a test that you can do every year, but it is reserved for selective patients. So if you are diagnosed with ischemic heart disease, do you always need an angioplasty or a bypass surgery? The answer is no. Everybody, including you and I, as we grow older, will develop certain amount of blockages. And these blockages do not cause a problem or do not cause symptoms until they reach a level of about 70%. So until they are 70% blocked, they do not cause an impairment to the flow of blood in the heart. Now, even if you have blockages, the first line of treatment is not an angioplasty or bypass surgery, but good medical management. So, if you are on good medical management, in all likelihood, your symptoms and quality of life will be far better avoiding any further procedures. However, despite optimal medical management by your doctor, if symptoms still persist, then an angioplasty or a bypass surgery is the right treatment for you. People generally ask me that I have blockages, can it be reversed by diet? Can it be reversed by yoga and meditation? Both diet and yoga meditation have tremendous positive influences on your lifestyle. However, once blockages are formed, your lifestyle will ensure the fact that they do not progress further. There has been no evidence to show that either diet or other forms regress or remove blockages which are already there inside your blood vessels. I get asked two questions very often. One, does alcohol prevent heart disease? And the answer is, we simply don't know. Alcohol has been shown to cause multiple problems, including increasing your sugar, increasing your cholesterol, and heart disease. There has been only one study of French red wine in one particular population that it has been shown to protect against heart disease. In no other study has alcohol shown any positive benefit towards the heart. So yes, the answer is very clear. Alcohol does not prevent heart disease. It might actually make it worse. The second question that I get asked often is expensive multivitamins and supplements. Do they help? The answer is no. No vitamins or supplements, including that of vitamin D, have been shown of any benefit. In fact, the only benefit that has been shown to prevent heart disease are two important aspects. One is fresh fruits and vegetables, and a large amount of them every single day. And the second is exercise. So eat healthy and start walking. These are two simple aspects where you can prevent heart disease or prevent the progression of established heart disease. I get asked this question about blood pressure. If there is a different scale or a different level of blood pressure which is okay as you grow older. The answer is no. Irrespective of your age, whether you are younger or older, the targets for blood pressure are exactly the same. You need to get your blood pressure to be less than 130 by 90. And unless and until you are able to do so, your risk of developing heart disease is tremendous. In fact, blood pressure is considered the silent killer because it has no symptoms. People say, well, You get angry because of blood pressure, but no, blood pressure has no symptoms whatsoever until and unless it reaches such a high level that it causes damage to the brain. And that is when people come with either severe headaches or visual symptoms. But until it reaches that level, blood pressure has no symptoms whatsoever, which makes it very, very dangerous. It is estimated at least 50 to 60% of Indians have high blood pressure. And what is very worrying is the fact that though blood pressure can be treated with good medication, 50% of all patients who are started on blood pressure medicines simply stop the medicines and putting themselves at a very, very high risk of heart disease. So know your number. Know your blood pressure number. And number two, please continue to take these BP medicines lifelong. The lower your blood pressure, the longer you will live. And the evidence is very clear. So make that effort to seek your number and work with your doctor to keep that under your control. The biggest problem in treating patients with heart attacks is early diagnosis. All of us know that heart disease, if it is heart attacks, if they are diagnosed within the hour or the golden hour, you can save multiple lives. Unfortunately, in our country, 1.5 to 3 million people lose their lives every year only because heart attacks are not diagnosed early enough. You will be surprised that the average time of diagnosis in urban India is close to 400 minutes, leading to the large mortality and morbidity. It is not only a problem that the patient loses his or her life, but the social impact on the family and the society of this one disease is immense. This is the reason why I started Tricog, is to use technology to enable every healthcare practitioner across the country to diagnose heart disease quickly and then connect them to a place where treatment can be done effectively. And those people with a heart attack, the treatment is standardized and simple. It could be a simple injection called streptokinase, which is around 1,000 rupees and given free of cost at government hospitals, to angioplasties, which can be done at higher centers. These two modalities save lives, and that is available to the people of India. Where there is a gap is only in diagnosing these patients and making sure that they enter the care pathway for the right treatment. This is where Tricog comes in, where we enable this diagnosis via a cloud-enabled ECG machine. And over the past 5 years, Tricog has served over 3.3 million patients, and some of them in the most remote places of India, and helping diagnose close to 1 lakh patients with heart attacks. Right knowledge is right health. Subscribe to this YouTube channel for more such educational videos.